All right, hello and welcome to a very special edition of Talking Retirement, everybody. I am here with Ocean County's favorite Medicare broker, Joe Gallo. So we are going to be talking today about some questions. I went into a local Facebook group here in Holiday City. I got 5 questions. Joe is going to help us answer them real quick. So if you ever have any questions, let us know in the comments. We want to make sure your specific questions are answered. And of course, if you ever want to get in touch with us to work with us in regards to Medicare, life insurance, anything like that, whatever you need to work with us, we're here for it. So Joe, you ready?
I'm ready.
All right. So the first question is, why isn't Medicare free like Medicaid, and that they deduct money from my ridiculously low Social Security benefits? So can you talk about that a little bit?
I can. Well, first off, no, Medicare is not free. Part A, which is a hospital type coverage, is because that's what we pay for all our lives when we work. Part B, on the other hand, covers all of your medical, your doctors and all your treatments, prognosis, diagnosis, everything you're going to need going through life. That has a cost associated with it. It's called the Part B premium. The Part B premium this year was $174.70. That amount comes from the fact of keeping Medicare alive for all of us. It's so that we can all experience and have Medicare when we retire fully. Those of us that do not take Part B are usually covered by credible insurance by an employer or a group plan, and therefore they don't need to join Part B. But if you're heading towards retirement, you're not going to be affiliated with a group, you're going to need to pay for Medicare. Again, Medicare Parts A and B together equal original Medicare, covering you for 80% of your health care, and it will cost you $174.70 a month. In 2024, that price will go up every year like everything else.
Yeah, exactly. And I think 2 points to kind of build off that is, you're right, it does have a cost. It's frustrating, it's not free. But the reason most cases Medicaid is so hard to get is because they do pay for nursing homes. So because that's such a higher level of services available, they're going to really make sure the people who need it meet the means testing and everything like that. And just because you don't qualify for Medicaid doesn't mean there aren't other government programs that can help reduce your costs, like SLMB, QMB, PAAD, Senior Gold. There are a bunch of other alphabet agencies that help you out in that regard. All right, so another question for you here, Joe, and this is relevant. We're not trying to stir the pot too much, but we have one. This was the day after the debate I asked these questions, and it was last night. Vice President Harris stated that she limited prescription costs for seniors to $2,000 a year. We'd love to know which states, because in New Jersey my plan says $8,000 out of pocket before no longer having to pay. Amazing what they will say to get elected, both sides. So I think he makes a good point. I think the main thing to know here is there's a lot of numbers, but I think if you just know where the numbers line up, you have a better idea of what she was saying and what your numbers are. So can you elaborate a little bit about that $2,000 and the $8,000?
Sure. A lot of Americans that are joining Medicare Advantage plans these days are finding that they're paying a lot more. A lot of folks that are in Part D drug plans that are not capping the amount out of pocket are paying a lot more. Capping the amount out of pocket within the plan is something new for us. The Inflation Reduction Act, as instituted last year by President Biden, or this year by President Biden, I can't recall, is going to offer us some additional discounts as seniors. And the biggest one is capping our out-of-pocket costs at the drugstores to $2,000. So what does that mean? Well, that means if you're on a very expensive drug, you're not going to pay more than $2,000 out of pocket. And yes, you may go to the drugstore and have to pay that on your very first visit. But one of the additional products that is coming to us along with, one of the additional benefits that's coming to us along with this $2,000 cap is also a payment plan, which means that if your cost in January is $2,000 and you're meeting your cap in the very first month, at the drugstore, you can talk to your druggist and have that aggregated over the entire year. So you will not pay the $2,000 in 1 month. This comes along with a long, long history of our government being able to negotiate prices with the drug companies. Well, it's finally happened. So what does that mean? Well, they're starting negotiations on 10 major drugs. That's great. The thing that the government wanted to give us, the benefit that the government wanted to give us, was to be able to afford our drugs each month, and they're doing so by capping the amount. I do believe that capped amount is going to come down. I do believe that we will be seeing lesser expensive drugs as these negotiations take place and are actually rolled out to American seniors. So I think it's just a waiting game at this point. It's actually happening. And let's remember that. We've been on Medicare for a long time without negotiated prices. We have clients that are coming to us with very, very very expensive medications that they need for 1 month. Now that's changed. I can't say it enough how extraordinary this is to be able to afford your medications. Granted, some people will still not be able to afford it at that level, but for that there are state programs in the state of New Jersey that will help you. Each state may have individual programs, but I suggest if you're out of New Jersey or not located in New Jersey that you check with your state officials. We all have Health and Human Services offices within our counties, so give them a call and ask. You remember, you're never going to get a benefit handed to you. The benefit is going to be there, and you're going to have to apply yourself to get the benefit.
I like the way you put that. I think a lot of people just don't know what they have available to them. And then kind of going back to the $2,000 cap, you did a great explanation of how it works, why it works. I think one of the things that was a little bit misleading in the debate is she said that she lowered the cost to $2,000 a year, but that change actually doesn't take effect until next year. So while they did pass this legislation and everything like that, it's been in the works for about 2 years, and the change for next year is a $2,000 out-of-pocket max. So the person who asked this question, who said, what about this $8,000 out-of-pocket? It's very possible you're in a Medicare Advantage plan that has an $8,000 out-of-pocket max, so we're kind of comparing apples to oranges. The other thing is there's a catastrophic phase with these Part D plans where it's $8,000 out-of-pocket for both you and the insurance company. And what that means is you're not going to pay $8,000 out of pocket. Between you and the insurance company, you'll both reach $8,000 before everything is picked up. And that is, I like to call, a soft out-of-pocket max, where it usually caps out around $3,500. So you're moving in that direction this year. It's going to go down even more next year. So it is something we're really happy to see, because like you said, Joe, we've seen far too many people who can't afford their medications, or they're just outside the state assistance limit, so it can be very hard to see at times.
Correct. And just to add to that, we really need to be careful, because there are a lot of up-and-coming companies, such as major retailers that only deal online, that are making themselves sound like we have the cheapest drug prices going. Be wary. Look, read, research, think about it, make sure it's right for you before you take that step, and realize what the government will be giving us in the beginning of next year.
100%. That's why I got to tune in to the NJ Life and Health YouTube channel, because we'll tell you what to look out for. All right. So big question. Why doesn't Medicare have dental coverage? I've seen people lobby to get dental coverage into original Medicare, but unfortunately it's not the case. My personal opinion, I think it's because Medicare Advantage wants them to kind of be like the only shop in town when it comes to dental coverage.
I agree.
So that's just my opinion. I have no, concrete things to say. That just feels like my belief. But a lot of people are forced to choose between original Medicare, which has outstanding hospital and medical coverage, but doesn't have those ancillary benefits built in, like prescription, vision, and dental, or a Medicare Advantage plan, which also has hospital and medical coverage, but does include those, but there's a lot of trade-offs. So I would just say, when you're looking into these dental benefits, a lot of times the actual coverage can feel less than promised. So just be sure you look at the fine print, see if there's a waiting period, see if there's a maximum contribution for major surgeries, because all those things can be major hang-ups once push comes to shove and you actually do need a major dental surgery.
Correct. And a lot of the Advantage plans where they used to give you a cap on how much you were going to spend out of pocket now are limiting themselves just to cover cleanings. And a full set of x-rays. And I'm always leery of that full set of x-rays. What's it going to show? Why are they giving it to me now? When actuality, I just want my teeth cleaned. For fear of what they may find. And oh my God, now I have to get that done too. So it's something that you really need to focus on. If you're going to pinch pennies with dental. Call several dentists. Don't put yourself in one basket. Make sure you're getting price checks from as many as you can. Get it in writing. I always say get it in writing, because then you have something to say, look, this is what you told me it was going to cost. If you don't get it in writing, they have the ability to say, oh no, that's not what it costs. And you don't want that to happen. So get it in writing. Dental is expensive these days. And a lot of us, as we age, we're losing teeth and it stinks and we need dentures. And I also say that, when you're getting prices, when you're checking into how much dental work is going to cost, go out of town. If you have the ability to go out of town, go out of town. There may be smaller dentists in areas that will not charge you as much because they're just looking for business.
Yeah, it's a good way to look at it. And going off that, I think a lot of times you can actually talk directly with your dentist. And
Correct.
Our experience talking with dentists, a lot of dentists don't necessarily like dental insurance due to denials and authorizations and everything like that. So sometimes they will, more or less say, why don't you just pay me what I would have gotten from the insurance company anyway? And, we'll kind of cut the red tape.
It's always worth having the conversation.
Yeah, a lot of them have plans that are very similar to dental insurance, but it's directly through the dental office instead of through an insurance carrier. So there are a lot of options, but just like you said, if you're going to pinch pennies, do it with dental. I think that's a good way to put it. Last question. I think this is another one kind of off Medicaid, but why can't they send people out to take care of the elderly that need it? So can you touch base a little bit on that?
Oh, expense, and who's going to pay it? Long-term care has been a challenge in the United States of America. There's no doubt about it. Anyone that knows and has gone through having to put a parent or a loved one into long-term care has realized that, wait, I need to sign my insurance policy over to them. I need to sign over my house. I need to sign over whatever I have. And it would be a really wonderful thing if it was just included, but it's not. It is an expensive benefit to have someone come to your house every day and take care of you. Then they have to drive home. We're looking at car maintenance, personal maintenance, the ability of who's going to do it if they're not available to you because they have a crisis of their own or for whatever reason. It's a lot. It's not easy. If you have children who are working a good job and having a good income, I strongly suggest tell them to buy long-term care now while they're young enough to afford it. As you age, you will not be able to afford it unless you have a lot of money. And I don't see this as improving anytime soon. It's kind of like our government is hitting one thing at a time. Right now it's prescription drug costs, which I believe are very important. And on the other hand, in-home services would be nice. But I don't think that's going to come up anytime soon. If anything, that we should really be advertising as a country to tell our American younger folks, do this now. Prepare for your future. We're not always going to have $1 million in the bank so that we can afford it. We're not going to be able to, not all of us are going to own a home during retirement. Some of us are going to be paying rent. That's going to make it even harder to get on. Some people, it may make it easier depending on how much their income is, but the government is always going to look to you to eventually pay for it. And again, that can come in the form of signing over your home. That could come in the form of giving up life insurance and any other assets you may have. It's called a look back, and our government does it. Don't believe they don't. And again, that goes back to folks, and I don't mean to reiterate, but I do, folks that believe others get all this coverage and help for nothing and for free. And I'm here telling you now that not even Medicaid will come to your home and take care of you. You will have to give up your assets to go into a Medicaid facility.
Yeah, it's already a very emotionally charged experience if you've gone through it, but there's also a huge financial and legal component to it as well. So the entire situation.
I happen, Ken, I'm sorry, but I happen to be a victim of it. Having had a mom that, suffered a stroke and had vascular dementia and was just lost. And I was told by the state I could no longer take care of her because of the level of care that she needed. And she had a home. And her home has a lien against it for the amount of money that she cost the Medicaid system above and beyond her Social Security checks. So it really happens. I am a victim of it, but that's okay. Love my mom very much. She got good coverage. She got good health care to the very end, and that's all well and done. But again, if you have children, talk to them. The sooner they buy long-term care insurance, life insurance, any other insurance that's going to help them at the end of their nightlife, or as we like to say, during retirement, is much more inexpensive to buy now.
100%. Yeah. And I think going back to the whole long-term care thing, kind of going back to the why don't they send people to people's houses, long-term care policies and certain things like that can be used to send a nurse to your house. A nurse can be anywhere from $50,000 to $90,000 a year, depending on who you get it from. So right off that's a huge cost that you'd have to burden. But there are programs, and we'll be straightforward, they don't pay much, but there are programs where you can get a loved one to be your caretaker. And depending on your state, the state will give them a small, but at least there's something. They will basically pay your loved one to be your caretaker. They'll get a check from the government. So that is, if you were looking for a way to get taken care of, there's many different options. There are varying expenses, but
right. And remember that person that becomes the caregiver gives up their job and their life in order to take care of you. So yes, they are compensated by the government, but no, it is not much. So they were probably making more working, and giving up your job to take care of a loved one is a tough decision.
Very much is.
Yeah. Once again, I've done it. It's tough. Couldn't go back to my old career, which is why I'm here for all you guys now.
Yeah. Well, we're all appreciative that you're here, Joe. So, so guys, this is the first time we've done something like this. We want to just have updates. We want to answer your guys' questions as they come up. So if you have any questions, you can always leave a comment down below. You can also email us, call us, whatever you're looking for. But we want to go directly to you. Me and Joe every week or every other week are just gonna, basically go live and ask some questions for you guys. So if you have any questions, let us know. If you want to work with me or Joe, Ocean County's favorite Medicare broker, and she also works a bunch of other places too, reach out to NJ Life and Health. We're a local, independent, family-owned brokerage that always does right by our clients. You can reach us at our Toms River, New Jersey office at 848-226-6897. You can also visit our website at www.njlifeandhealth.com. We work in over 20 states, and New Jersey is our home, but like I said, we work in 20 different states. So Joe, thank you for your time. We're going to be doing more videos like this, and we will see you guys in the next video.
Yeah, see you in the next video. Have a great day.